A full day of negotiations just wrapped up about an hour ago. Kapiolani Medical Center officials and the Hawaii Nurses Association trying to come to an agreement on a new contract to avoid a strike and a lockout. Kristen Concilio joins us live from the hospital with the very latest. Kristen.
Marissa, the clock is ticking because the Hawaii Nurses Association is set to strike here at Kapiolani Medical Center for Women and Children on Friday the 13th. Now, this will be their second strike of the year. Kapiolani nurse Paulette Vasu says she's angry and feels like her back is up against the wall. That's after hospital executives threatened to lock out Kapiolani's nurses if the union strikes.
We are shocked because we feel like they're saying if we don't take their offer, then they're going to lock us out. That's kind of like mob tactics, you know, that's strong-arming us into taking a contract that we don't feel is right for the nurses or the patients.
The hospital says it's offering to bump up nurses' salaries to the highest in the state, but Vasu says it's not about the money.
We feel like they're bullying and harassing us when we try to make the working conditions better for our nurses and our patients. It's about patient safety. That's what it all boils down to.
Nurses say they regularly work overtime and there's simply not enough staffing. And when they complain about it, they face retaliation.
We have nurses that have been there 20 plus years, and this is the way you're going to treat us.
But a lockout involves keeping people out.
Honolulu employment attorney Jim Bickerton, who is not involved in negotiations, says lockouts are an extremely rare, heavy-handed tactic.
I can't even remember in the years that I've been observing the scene here, anyone ever using the tactic in Hawaii.
He says a one-day strike does not justify the need for permanent or long-time replacements, and it could lead to dire consequences.
They may be skilled, but they haven't worked in that hospital before. You're going to have breakdowns. You're going to have risks to patient safety. To me, it seems a reckless and foolhardy thing to threaten a lockout over a one-day strike. It's not good for patients. And in the end, the hospital, whatever money it's trying to save in the labor side, it may end up having to spend on the malpractice side.
Now, Kapiolani's nurses have been working without a contract for almost a year. Reporting live, I'm Kristen Concilio, Island News.